I will say this, got one under its
Call the meeting to order. The affidavit of posting was posted accurately. As far as roll call, everyone is here, but Supervisor Smisek is absent.
He just reached out to me.
Okay.
He is trying to get a manager to replace him at work. We'll be here as soon as he can.
Okay, thank you very much. Let's rise for the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Right, I would entertain a motion and a second to accept the consent agenda.
Moved.
Second. Supervisor Kelling, second by Supervisor Gurath. All in favor?
Aye.
Any opposed? All right. So the discussion items, first today we have Human Services Behavioral Health Division, the quarterly report from Doug. Welcome, Doug.
I'm here to give updates on our entrepreneurial operating system initiatives. The initiatives we have for behavioral health were to implement to expand mental health services for youth, which falls under the pillar of treatment and prevention. The two we had were to implement family-centered therapy and to implement parent-child interaction therapy. Both of those are on track. We are, the last thing that we have due is the certification and outcome reporting, which is pushed out till the end of September of next year, because those things will happen after we have the program up and certified and we're running. So far everything is on track. We have clients assigned, we have staff providing the service, and we're going through the certification process. Any questions on that?
How many are you expected to treat in this program?
A full caseload is considered 5 families per therapist. So we have 2 therapists right now, and there's one in the process of possibly being hired with our contract agency, PSG. And there are 4 active cases right now. So the 2 therapists each have 2 cases right now, and 5 will consider to be fully staffed because you're really treating the whole family.
Okay, thank you.
Anything else?
Anyone else? Questions?
The other initiative is parent-child interaction therapy. That also is on track. We're in the early stages of that. We've got training confirmed. Training dates are confirmed. And we have a short list of potential clientele for that, which means families it's been discussed with them and they're in agreement and they're ready to engage once we have the training completed. And then the training happens alongside the actual delivery of the service. So those 2 things happen at the same time. So we're on track with that as well.
Excellent.
Question.
Yes.
In this particular program, is this where there may be the kids may have been removed from the home or trying to reconnect parents with children? That's
the family-centered therapy model. More so, those are kids that are typically involved in youth justice and children and families and who have been placed out of the home, and we're trying to either keep them in the home or have their return to the home be successful. So that would be the first initiative, the family-centered therapy. PCIT is for infant to 3-year-old children to help parents who don't have good interaction abilities to better engage with their kids. And that involves one-way glass and observing them and then talking to them through some sort of communication device about how to validate their child's behavior and what to do next and what are the next steps in like connecting with your child in terms of playing with them and getting down on their level. So it's a little bit different than the first piece in that respect.
If I could add, so PCIT is probably considered more of a prevention type of program. Because it's really focused on early childhood support. But the family-centered treatment program is a huge initiative for us because we are working with a national model, and we're hopeful to utilize their system for data tracking, because we are looking at trying to get to further on in this EOS process, a goal that would really provide some data as to the outcomes of youth and families that are participating in this program. It is what I think our county executive calls a stretch goal, so it's not on here because we don't want to pre-promise anything to you, but that is one of the long-term outcomes of that program, is really trying to keep kids in the home and with their parents.
And so a strategic priority in our modeling system. Very good.
Anyone else? Thank you, Doug.
That there's one other pillar,
Okay.
which is, or the other initiative we're doing is expanding crisis response. And we are in the process of planning to build a co-responder model where we have law enforcement and crisis staff. We have a crisis responder embedded with law enforcement is a better way to say it, and they respond together. So they're on the road together. They get dispatched to mental health calls through dispatch. They present at those and then they proceed from there. So it brings that counseling, that crisis, that mental health specialty to cases that are oftentimes strictly a law enforcement response first. And as, I mean, I'm sure you've heard, it's kind of cropping up all over the country. It's kind of the new
Model.
way to proceed with mental health cases and people in distress in the community. In fact, there's a conference later or in mid-September, which I'm going to go to, and there's 2 different workshops regarding that exact thing. So we're on track with that too. We have to develop a job description right now, and then we're hoping, depending upon being able to get staff and the referendum, to launch that in January. But again, it really depends on our ability to find staff as well as the sheriff's office ability to get officers too.
So again, and I hate to ask all these questions, I kind of want to understand these
Yeah, please
programs
do.
a little bit more in depth of what it is they're doing or trying to accomplish. Do you foresee this position as being somebody who the communications center would send out separately, or is this a rides with a particular officer to a particular call? Say, let's just use a case of domestic violence, perhaps, where the subject is probably known to us and may have had several mental health issues in the past. So now instead of sending the deputies straight, we're going to send this person and or a police officer.
Yep.
So they would arrive with that deputy but not the patrol deputy.
Yeah, they would, right, that's correct. The person the crisis staff is going to ride with would, I guess, technically be a patrol officer, but they're not going to be doing regular patrol. They're going to be responding to see together. They could respond to a domestic violence call, especially if we've had previous history or we know them and they're available. They could respond along with regular reporting, patrol officers at the same time.
Right.
And then law enforcement can sort of secure the scene, make sure everything is copacetic. And then the crisis worker can go in and do whatever they need to do, assess the situation, make referrals, just be a sounding board, set up referrals to services, or set up a time for them to come back and just check in the next day or the next week, whatever might be most appropriate. So it's going to be very, what's the word? Sort of fly by the seat of their pants, I think, in terms of what they're going to do when they get there. But the point is to have them respond together instead of law enforcement going first, them being the initial responder, and then calling crisis. And then there's a phone call with crisis, and they talk about, well, what should we do? What would be the best way to proceed? Sort of cutting that piece out and having them respond together. Because so much of what law enforcement does right now is really a lot of social work stuff.
Right.
And so putting somebody embedded with them right away will then they can take the lead in those calls. Once the scene is secure and there's any kind of issues with safety resolved, then the mental health professional can get involved right away, right on the front end, instead of having that weird kind of lag time.
So, and I guess that was where I was leading to second. Obviously, safety and security has to be number one with this, because I can't imagine the nightmare that would happen should one of these mental health professionals be injured or worse on the job. I mean, we want to make sure that any scene is secure, and that their safety is first and foremost so that there is no issue. I mean, I understand our officers face great danger every day in these situations. So, and I like the idea, but I'm very concerned that their safety is first and foremost, not that they're.
And there's different models out there. Some of the co-responder models have the mental health person wearing a vest.
Absolutely.
Some don't. Some use unmarked patrol cars, some use marked. Some officers are in uniform, some are in plain clothes. So we're drilling down on some of those details, and it'll really be our partnership with the sheriff's office to kind of take direction of what they think is most appropriate in terms of the safety piece. At the time, he was the assistant ACS or crisis supervisor. He rode along with a sheriff's deputy for 20 hours over a period of time. And he got a real quick and dirty, if we need anything, rifles are in the back of the car, here's how that works. And those are the details we have to figure out, what will be the protocol in those situations? Does law enforcement go in first? Do they go in together? Do they clear a scene and then they have mental health come in? It just really depends on probably what the call consists of.
Yeah.
Our familiarity with the person, if we know that there's weapons in the home from previous hit, there's going to be so many variables. So yes, those are all the details that we are appreciating as we go down this road. So
Yeah. Good.
I believe Sheriff Schulteis talked about this at some point too, a little bit, was this the pilot program, little mini pilot program that you tried? And both sides saw great benefit. The social worker went, okay, this is what we should think about. And the officer never thought about that angle. So it has promise when we work it out.
yeah, and those are the things that we're talking about right now in terms of that training piece. Do we have law enforcement come and spend time with crisis, just getting a feel for what we do behind the scenes, what kind of things go into our protocols, and then vice versa. Us doing training with law enforcement to get a feel for what they do when they roll up on a scene, what's their first protocol or their the first detail that they pay attention to.
I think what's important to know about the work that's going on with this initiative is all of the questions that you're asking is essentially what the team is working through. We have a draft MOU, we're working on job descriptions, we're working on an onboarding plan, and we've been meeting monthly for 5 months. And so, those are all because right now it's a conceptual model, but we want to be prepared if and when the referendum passes or some other types of funding are identified so that we're ready to go. So it's been really neat to watch the team sort of go through that process. The sheriff and I have been part of those meetings. And, a lot of these questions you're asking are the questions that have come up. We want to be as prepared as we can, when we go live, but some of it will also be determining what's the best intervention with this model as we go and as we learn more.
And I only want to state just for the record that doing a program like this obviously involves some very inherent risks. And when it comes to my part on this committee, helping to mitigate those risks and providing proper funding to help mitigate those risks should be a priority. Because if we're going to do any program, I believe we should do it correctly. And if we're not going to do that, then we shouldn't do it at all. So I think it's just important to put that out there, to understand that as you're putting this together, and only speaking for myself, you do have somebody that really wants to make sure that safety is that priority and is willing to listen to whatever thing has to come out in regards to keeping those people safe. So.
Thank you. I appreciate that.
Right. I agree with Dennis. That was my first thought when you're pairing somebody from Human Services with an officer going into a domestic situation. Safety was my first concern with that too. So I totally agree.
And I think, one of the things that we've been exploring too is some of this standard operating procedures that the Sheriff's Department already has. So for example, they already have I forget what they call it, but like a community ride-along SOP. And so a lot of those components of that will be incorporated into this team as well, because there are going to be situations where that person's going to need to not either, wait at the station, wait in the car until, a scene can be secured. But those are all the itty bitty details that we're working through.
And the nice thing is this is being done, and so we can be in contact with other, agencies or counties around the state who are doing it. We can find out from them, like, what did you do wrong? What did you learn? What was something you wish you would have done? So it's, at least we can look at some of those other models and then pull away the good things from them too.
Good.
That's it. And then the other one we have not started yet, that is our, to expand treatment services for substance use disorder. We're looking long down the road, and it's really dependent on the opioid settlement dollars in terms of a sober living facility for women, which is still a need in the community, but that's just kind of parked for now as we await the disbursement of those funds.
And since it's been brought up, and although it wasn't on the agenda, I will just preview for this committee that it is my plan in September to bring forth a request for a general fund transfer to pre-fund transitional housing, sober living, with a mechanism to pay us back with the opioid dollars. So that all of that information will be brought to you in September for consideration.
And then this initiative will get, edited or changed, and we'll be reporting on that as well as we go forward.
Great.
No matter where the funds come from.
That's good.
Any other questions for those?
We're good.
Okay.
Thank you again, Doug. Appreciate it. Next, from the Human Services Administration Division, the quarterly report, we have Lee and then Anita, or Anita, then Lee. Doesn't matter to us.
Hello.
Hello.
So I want to report to you today on my EOS initiative to improve the efficiency of our external provider billing. So just to expand a little bit on that, we do contract with several external providers that provide services to our clients, behavioral health services, under the Comprehensive Community Services Program. And this program requires billable documentation on the services that are provided, so that we can then turn around and bill those to Medicaid and, get revenue back to offset some of our program costs. So right now, this process is very paper driven. It's creating inefficiencies. It can also prolong the payments and the revenue that we get back. So what we want to do with this is identify the bottlenecks and the opportunities of, where these inefficiencies are, and then determine the best possible automated process that we can use to improve the problems that we're having and make it, a little more efficient. And in turn, that will, we need to be a good business partner to these providers. So by optimizing our efficiencies and our workflow, that's why I developed this initiative. So we have started analyzing the process, or the workflow, I should say. We're meeting every other week to do that, and then we'll be putting together a master plan of where to go from there. So we're on target for our September goal date. So questions or?
And if I could just add, I think, maybe this isn't as, exciting seemingly as, big crisis initiatives. But, for those of you who haven't been as close to the human services world the last several years, we've done a fantastic job in really aligning and reducing our budget. And one of the ways in which we did that was expanding, increasing our external providers and moving a lot of them to fee for service. And so they're providing fantastic work for us, and the dollars that they receive is based on the actual work that they do. And so a lot of these providers, there's zero tax levy that's connected to their payments for services. So, looking at efficiencies in in the way that both the invoices come in and the timeliness in which we pay those is very important to these providers, and we don't want that to lose them because they're not getting paid in a timely fashion. But it also is on our end creating a lot of just extra touches and work in the current process. So I think I'm really excited that Lee chose this initiative. I think it'll really improve our business practice overall.
Well, now that you added to it, will that, I don't know what the reimbursement rates are. Are we losing any reimbursements due to the slowness of this? Or do you feel this would improve reimbursement rates? Or
It really
is it just a matter of streamlining?
To do with the rate of reimbursement, because, they do the work and they document it. But it's in that process because you need a clinical overview of it to make sure that what they're writing is clinically appropriate. And then we have to bill that and then we pay them. And so currently it is as Lee said, it's a very paper heavy process, and lots of people touch it, which if anybody knows, a lot about all of the process improvement, that the least amount of people you can have touching a process, the better.
Yeah, absolutely.
Anything else?
All right.
Okay,
Thank you, Lee. And we have Anita next. Welcome.
Hi there, thank you for having me. The initiative that I'm currently working on is creating a more efficient children and families billing system. Specifically, the system would house the parental fees for the court-ordered supervision costs, residential care, shelter care, and the children long-term care costs that the parents are responsible for reimbursing the county for. With my unit, I'm the billing supervisor and I'm in charge of ensuring, accurate and timely revenue to human services. And so we're always looking for efficiencies and automating processes so that we can continue to provide quality services to our county residents. The issue with our current system is that it's not best practices. It's inefficient, paper-driven, and extremely time-consuming to complete. And so our initial goal was to focus on identifying possible solutions that could potentially resolve the issue. We explored options and we've identified that a current electronic health record system that we use has a functionality and capability of housing this billing, so that we're in the initial phase of setting up the system, and we're going to work with IT to move forward with it with testing and implementation. So we're on track. So yeah, we're excited.
It's always nice when you can reduce the workload, right?
Yes, absolutely.
Right. Any questions? All right. Thank you, Anita. Right. So next we have under the action items, the 2022 resolution, Human Services Department staffing change. And Julie will address that. It's kind of about creating a new position in mental health.
Yep, so the resolution before you is approval of us to increase the human services headcount by one mental health therapist. The funding currently exists within the county. The Sheriff's Department currently has funding allocated for this required service within the jail. It's not quite enough for a full FTE, which has been part of their struggle with providing the service in the jail overall. But we do also have some grant dollars from our medication assisted treatment grant that we receive from the state that is a partnership with the jail. So currently individuals who are identified as having an opioid use disorder and are interested in receiving medication assisted treatment prior to release, we work with them to make sure that that medication is administered and then provide that follow-up service so that they have a continued place to go for both that level of treatment and other types of treatment services. And so, in our conversation with Captain Lehman and the sheriff, it really seemed like it made sense to sort of combine their dollars and these grant dollars to try to create this full-time position that would be housed within the jail, both to meet their statutory requirements that they have on suicide assessments, but also to increase the capability of us connecting people at discharge to services within the community. And, we felt like it's a natural fit because of, it being a human services employee and having a supervisor that's a human services supervisor that could provide them that clinical support, but then also that connection to the services at the mental health center and in the community overall. So we are both of these types of dollars are funded for 2022 and 2023. The budget office has signed off on this and said that they agree that it does exist. Again, this is one of those areas that is part of the referendum. That is allocated for funding or for the sheriff's department, specifically the jail, to have increased funding for mental health services within the jail. And this position would be that one of those strategies for that. Obviously, if the referendum doesn't pass, then when we go through the 2024-2025 budget process, we'll just make sure that that it is fully funded. And continued. So we're very excited about this partnership. We think it's the right way to go in both meeting the jail's needs as well as, really trying to connect people to services once they're discharged out of jail. Yes.
So is the grant just for this biennium?
So the grant is, grants are very interesting. Some are time limited and then some are, this is funded through GPR funds through the state, which means that they are in perpetuity, right? This program will always be funded. We need to reapply every 5 years. And we did just reapply for our 5 years. And so certainly, something could happen and they could decide that Washington County shouldn't get it. But it's very unlikely. The historical piece around that is that, we would continue to be able to administer this program, especially as we continue to demonstrate the outcomes. It's not a huge grant. The grant overall is like $64,000, and we would use around $33,000, which right now we have allocated for case management anyhow. We would just shift that to this person. And so, again, if something were to happen, I'm sure that we would work within our budget to try to cover those if the referendum doesn't pass.
Thank you.
This is going to be replacing, though, an existing position that is coming to the end of its contract within the sheriff's department, if I remember this correctly, right?
So my basic understanding is that the sheriff's department has historically contracted this service out. And they've the outcomes to that has slowly decreased in I think their satisfaction with the types of providers and the work of the providers, and the cost has increased. So when their most recent contracted provider gave notice that they were no longer going to be able to have that contract, and Captain Lehman, I think, took it out to some of their providers, the cost was much more than what they have budgeted, and probably much more than what we would be asking for this position. And also, you're not getting that continuity of service, with human services and then with community providers as well. So, we're pleased that the sheriff's department is interested in trying to improve their service and work with us as a partnership. And obviously, if neither of us are satisfied, I suppose we could do something about that, but I hope that doesn't happen.
Yeah, and that's what I was kind of leaning towards. I knew about this and I knew that the price was going to be going up considerably. And this is another opportunity where we have cooperation and collaboration, even not just with other counties, but within our own departments, that could benefit the community and share expenses and make things cheaper. One way or another, we're going to have to go ahead and pay for this. This service is vital to the jail, and it would have gone up substantially probably even more than just trying to utilize these dollars. I mean, it's hard to say, but I really like the idea of how taking care of the people in the jail gives you an idea of what you're looking at with this person when they leave jail, what type of treatment they need when they continue on back with their lives. And I think that's just such a great benefit and why collaboration and cooperation works so well within our county. So I totally applaud this, love it.
I just would also like to add to that one of the benefits of this as well is that, people take time off, they get sick. And so because this position will be supervised by Acute Care Services, which is our crisis team, they will be able to fill in when this person is off. And currently the contract that the Sheriff's Department had is ended. So currently our crisis program is providing just the basic bare minimum requirements for the jail in the interim until we hire this position. So it is actually in all intents and purposes has started, but we've just been doing that and absorbing that into our current work.
Very good.
Do you have a motion and a second on that?
Yes, I would entertain it just as long as there was
Yeah, a motion to
okay,
approve.
Supervisor Kelly,
I'll second.
Supervisor Grass, second. So to approve this resolution for Health and Human Services Behavioral Health Division to add a one FTE, not quite one FTE is what it is, how it's worded, clinical social worker to provide mental health in the jail setting. All those in favor?
Aye.
All those opposed? All right, it passes. Thank you. Our next meeting date is Wednesday, September 28th, same time, same place. This meeting is adjourned.